The only justice Trump can receive is through winning. Paint splattered on George Washington here in New York City. Is Mount Rushmore racist? They're coming for superheroes. Are coronavirus cases moving across the border? The NBA goes all in on woke and reopen the schools this fall. Welcome to the Buck Sexton Show, everybody. Another day fighting against the insanity, the lunacy of the collective and collectivist left. Can you feel that panic rising? Oh my gosh, everybody, start your freak out engines right now. That's what the media wants you to do. They think we'll all be better off if you're constantly afraid, constantly scared. And yet all you have to do is look at what's really happening across the country, and everything will seem manageable. Not perfect, not risk-free, but life has never been perfect and risk-free. How long did it take for us after 9/11 to finally feel like we weren't going to get hit with a mass casualty terrorist attack at any point in time, right? There was this huge national security apparatus that sprung up anew, not just the one that we already had, meant to prevent planes from getting blown out of the sky, crowded subways from being blown up. We lived with that for years and years. But, we didn't shut down, and we got hit, and things were definitely tense for a long time because of the threat of the global jihadists targeting our society and trying to destroy our civilization. But we won. We never had a real victory dance after all this. We never took a moment to say, yeah, we won. And that doesn't mean that they won't come back. It doesn't mean that that's a fight that's over. But this round, we won. And I'm here to tell you that we're also going to win this fight against COVID-19. I'm here to say that I'm doing everything I can to deal with a very clear campaign from the left to make fear and anxiety and anger their political campaign. I mean, that's what this all is. You might be thinking to yourself, hold on a second, where are all of the news stories about Joe Biden on this policy and Joe Biden on that policy? No, that's not the plan. You see, the left, the Democrat Party, is trying to make this country as desperate and unlivable, particularly in the cities, as possible. To tell us that we're heading toward a future that is a disaster, that everything is going against us, and to build a savior complex, not around Joe Biden, who is a nincompoop, and we're all very aware of that, but around not Trump. That's all it has to be. A change from Trump. And in a sense, the media, the academy, Hollywood, corporate America, the culture, by and large, has all agreed to hold everyday average Americans hostage. And the only way that we are freed from this hostage situation is if we do what's right by voting Trump out of office. That's the only way that things can ever go back to normal. That's the perception they're trying to create. And that's ultimately what this is really all about. That's why you don't see very much talk about this issue or that issue. Where are all the deep dives into Biden's past? Or where are all the big pieces on the victories that Biden had in the Obama administration? We're basically in July, folks. July, August, September, October, vote. That's how this is going to go. And as long as they can keep people afraid right now, they view it almost like they're stalling the economy and they're stalling our sense of improvement at the starting line, if you will, of the race. They're trying to hold us back so that no matter what happens in a few weeks, they will have done the necessary damage to our psyche, to our economy, and to our freedom to prevent Trump from getting reelected this fall. That's the plan. That's why all this is happening. When you look at the data about different states now that are having spikes in cases of COVID-19, and now there's all this focus again on masking. Oh, just wear a mask, wear a mask. Ask someone in the medical profession, what is the percentage of protection you get? Wearing a mask in a room with somebody who has COVID-19 versus not wearing a mask. How much of an improvement does it make in your defense against the disease? You know what the answers you'll get? They don't know. They don't know. And I would ask you this. If mask wearing was highly effective, if it was highly effective in preventing the transmission of this disease, then why is it that people who have been in situations where they were constantly masked still get the disease? You know, we don't have answers to this. You know, Cuomo is out there today, and he's a nightmare because he has the worst record as governor of New York, the worst record of any state on COVID-19. And he's out there saying, wear a mask. Don't refuse to wear a mask. The smart people looking at the data wear masks. Really? You know that mask compliance, according to the polling and the data that we have in the EU, mask compliance in some of the states that have had the lowest per capita death rate from COVID-19, Norway, Sweden, Denmark, Finland, mask compliance is very low, meaning that people aren't wearing masks. I don't have answers as to why, you know, they're not getting worse hit by the disease other than to say they're not wearing masks and they're okay. Relatively speaking, this disease is going to be everywhere. It already is everywhere. But how badly does it hit a certain population? How badly does it spread? There are the comorbidities that you have to look at. You know, people keep pointing to Japan. Do you know what look, obesity as a health issue is directly tied to fatalities from COVID-19. This is known. And the United States has a 10x the obesity rate of Japan, for example, which has had very, very few deaths from COVID-19. You know, there are all these different factors that go into the response and to what we should be doing. But instead, this gets politicized right away. This gets turned into, well, you know, it's like we're going back to the beginning of this when we didn't know anything. Hospitals are not being overwhelmed. There has not been a single case that you can point to of a person who has died from COVID-19 because there was no medical care in this country. There was no medical care available. There was no capacity. I'm not saying people haven't stayed home who should have gotten care. That's a different issue. Hasn't happened once. But now we're going to go back into lockdowns. I just spoke to a guy this morning who runs a gym. And he said, you know, in New York, we were going to be in phase 3 for gyms. And then we're going to be in phase 4. Now we're in phase maybe never. Based on what? What is the purpose of this? So you can be in a room, you can be in an office now, but you can't be in a gym where you can control how many people are in at any one time? How many high-risk people are really going in to throw weights around? I know there are some people in their 60s who still like to deadlift and bench and all that, but you know, can't we try to control for the risk of what's actually there instead of just telling everybody, no, you can't, no more gyms. Even private gyms, not just gyms that are open to the public, private gyms cannot open. So unless it's just yours and you're an individual, if there's any access to the outside, this is madness. No one can really think that this is a good plan or a good idea until you look at the politics of it. And then it all starts to come together. It all starts to make sense. If mask wearing was really effective, then we could just let everybody go back and do what they want to do, but wear masks, right? But we know that there would still be transmission of this disease. In fact, the data, if you want to look at it, tells you that hand washing is actually much more important than mask wearing. But we don't have a way of virtue signaling when it comes to hand washing. People can't walk around, my hands are clean, I washed them. So that hasn't taken off in quite the same way. Mask wearing outdoors is dumb. Mask wearing indoors, TBD, data, still have to look at it. And for people that are at really high risk, I guess you do what you got to do. You do what you can. But for the general population, this is absurd. But Governor Cuomo is out there saying, wear masks. Mark, play clip 1.
The White House has been in denial on virus from the get-go. And the federal response has just been wrong. That's not a political statement. If you look at the facts, that's exactly what it says. You have coronavirus increasing in 32 states across the nation. The rate of increase is only getting worse. And a number of excuses have been made for this over the past weeks to further the denial. First, they said, well, it's because they're doing more testing, and that's why the number of infections are going up. Not true, because the number of hospitalizations are also going up. The White House has been saying reopen fast because that's good for the economy. And we have to get the economy going. Yes, we have to get the economy going, but reopening fast was not good for the economy.
What is Cuomo's plan? Does anyone in the realm of journalism want to pretend that they actually care more about their country than their political party for a second and ask him, so what's the plan? We lock down until there are no cases? We're going to be in lockdown forever. These morons who think that they have the answer to this never tell us what we're actually trying to accomplish. Lockdowns are not going to defeat the virus in America. It will destroy the American economy, and it will ruin lives. And the costs of lockdown, we've already been through this, the cost to health and to lives from doing this is incalculable, but we all agree it's immense. Dr. Fauci himself says lockdowns cannot continue indefinitely. It is a bad idea. So what do we do? Just keep dragging it out, keep dragging it out, keep dragging it out. Cowardice and craven politics. That's what's driving this decision making from Cuomo. Oh, he's Mr. Big Guy with his hospitalizations are going up. You know what else is going up when they look at this? Or rather, you know what else is a very important statistic? The speed with which people are leaving the hospital. Most of these hospitalizations that are increasing in Arizona and in Texas are younger people who are in and out of the hospital in 2 to 3 days. And part of this is because anybody that has the symptoms of the disease is going into a hospital to get tested, and maybe they are told to stay there for observation for a day or two. But you're seeing a lot of cases, and this is what the data actually says, for people to pretend that they care so much about the science. You're seeing a lot of cases where people are in for 2 or 3 days. It used to be 2 to 3 weeks, and people weren't even coming off of ventilators once they went on them. They were dying after weeks of fighting for their lives on ventilators. We're not seeing that. There are a number of reasons why. The biggest one is that most of these infections are younger, healthier people. And people who are young and healthy are at an acceptable level of risk from this disease. Even if they get it, they're almost certainly going to be okay. The same way that we accept a certain level of risk from the flu, we accept a certain level of risk to the under 60 population from COVID-19. This disease is worse for people over 60 with comorbidities than flu. That has been established. But for younger people, it's not as bad as the flu, quite honestly, especially when you get down into the ranks of people who are under the age of 20. The flu can kill a 10-year-old. COVID-19 is almost no risk to people who are really young. And remember, you can die, believe it or not, you can die from strep throat if it progresses enough. I know that it doesn't happen very often, but it could. Right? There are risks from all kinds of health concerns in society. But you see, the plan here, this is a couple things. It's fighting back against the pandemic panic, but it's also understanding why we have to keep returning to the same issues, the same arguments. And why there's no honesty in this, because there are people for whom the Trump presidency is a constant, unacceptable assault on their psyche. They just can't handle it. Remember things that we've been talking about for years here on the show. Trump has psychologically broken the left. He has really caused a mass hysteria. He has caused Democrats to be in the grip of a mental illness. They really think that, oh my gosh, the country is going to collapse and we're all going to go to war and all these terrible things are going to happen. And now there's this opportunity for them to just plunge all of that angst and rage and fear and anger, all of it into this issue and to blame Trump for it, when what we really need is clear-headed thinking about what do we know and what should we do. Instead of, oh my gosh, this state is bad, that state is bad. You see this all the time, the way that the media is reporting on this. Cuomo has, look at the record, so to speak, right? I remember when I used to play sports, the ultimate thing to say to somebody who was talking smack on the other team was to say, look at the scoreboard when you were crushing them, if you were crushing them. Okay, look at the record that, say, Florida has versus New York. Governor Cuomo put on a clinic. He's a prominent Democrat who was, of course, being talked about as a possible VP for Biden. Now, that's faded away. He made the worst decisions, and that's not a theory. That is what we see from the results. The worst decisions at the worst time of any major political figure in America. And now he's going to blame Trump and say there's a mask mandate? I got an idea for you. Governor Cuomo, where does this mask mandate power come from? Where is the constitutional right to tell everybody that they have to wear a mask? Who's going to enforce that? You're going to start arresting people? You're going to lock them up, take away their freedom because you want them to wear a mask, for which there is no conclusive scientific evidence yet. There are studies even that suggest, including published on the CDC website, that there is little to no benefit to mask wearing. And there are plenty of reasons why that is. Your eyes, folks, guess what? Great way to get a disease, unfortunately. So unless you're wearing a mask that is completely fitted so that aerosolized virus can't get in, and you have a total seal over your eyes, guess what? But no, they want a federal mandate. That's what this is now. They want everyone walking around in masks because that goes right to the psyche of the Democrat Party. You see, the Democrats believe America has been sick for 4 years. They think that we have already been in the grip of a pandemic, but that pandemic was Trump. This most recent real disease outbreak has become an excuse for them to unleash that part of their psyche that Trump has so damaged, such that they think the country is on the brink of collapse. This now becomes the excuse to explain why they've been acting like such maniacs for the last 4 years. It's all about Trump in their minds. Otherwise, they wouldn't be able to just pretend the mass protests on the streets with no social distancing. They wouldn't be able to just wash that away from their memories. No, it's politics. That is what is driving this. Don't let them get away with the hysteria.
Dr. Fauci said this. CDC head said this. The main driver was the virus came from Europe, and it was the greatest miss by the federal government of all time. China virus, China virus, China virus, China travel ban. Forget the China travel ban. It was in Europe.
It came to Europe from China, you moron. And the reason that we don't think of the virus in this country as coming from China quite the same way is because of the ban on travel from China. But, you know, if this is about mitigation and saving as many lives as possible under the circumstances, fewer infected people coming into the country early on in the outbreak is clearly a good thing. And there were a lot of infected people in Wuhan and the rest of China. So what is his point here? This man is a hack and an idiot. But the Democrat Party is all reading from the same sheet of music here. It's BS. Working from home is driving up one of the worst types of cybercrime out there, home title theft. You see, we're doing it all from home these days. Working, banking, video conferences, meal deliveries, and shopping. Cyber criminals are actually targeting our homes. Well, actually what they want is the money they can get by taking out loans against your home. This crime is called home title theft. The FBI is trying to get the word out about it. You see, your home's title is out there online. Home Title Lock is how you protect your home from cyber thieves. You see, online they can find and forge your signature. The bad guys can take that and then state that you sold your home to them. Then they'll take out loans on your home and leave you in debt. Banks, insurance, and basic identity theft services do not protect you. Home Title Lock puts a virtual barrier around your home's title. Protect your home now. Go to HomeTitleLock.com and register your address to see if you're already a victim. And use code BUCK for 30 free days of protection to help you through this crisis. That's HomeTitleLock.com. Make sure you use code BUCK.
That's one of the reasons why we have to make sure we engage the community as we're doing now, to get community people to help us, for people to understand that we are doing everything we can to show that it's safe and that it's effective, and it's for the good of them as individuals and in society to take the vaccine. So we have a lot of work to do because, as you well know, we've spoken about this intensively in the past, there is a general anti-science, anti-authority, anti-vaccine feeling among some people in this country.
Can we worry about what's going on right now and not have these projections about the anti-science, anti-vaccine people causing the problems? Because we don't have a vaccine yet. And based on the possibility of mutations, we may never really have a perfect vaccine. Coronavirus may be with us in a cyclical, seasonal fashion for a very, very long time. So what exactly are we trying to accomplish with all of this? There seems to be a lack of comprehension here about what it means when younger, healthier people get infected. As long as younger, healthier people are getting past the virus and then have immunity from the virus, which is what the science tells us, the more people who get this, who beat it and who get past it, the better off we are as a society because we get closer to herd immunity. So, if you have in an area 30 or 40% of all people under 40 that have already had this and beat it, even though those who are in the society in that area who are at higher risk are still out there and don't have immunity, there is a lesser risk of spread to them because the immune population is larger. So as long as we are taking measures to protect those at higher risk from immediate spread, we should not be panicking about people who are at very low risk from this disease contracting it. When I say low risk, most people who are getting it under 40 don't even know they have it. They don't have any symptoms. And it's not like we're saying, oh my gosh, there's a 50% mortality rate, so hopefully, you'll make it through. No, there's the chance if you're in the low risk age bracket from this of dying from it or even being severely hospitalized for it, not in the hospital for a day or two, but being in the hospital for a couple of weeks, the chances, less than 1 in 1,000 at this point. So what exactly are we supposed to do as a society? What is the plan here? The health experts who were silent for a couple of weeks while it was whose streets are streets, we're protesting injustice, but we're all wearing masks. Really? We think that all of a sudden Minneapolis has a huge spike in cases of people under 40. And no one's even raising the possibility over there at all. Maybe it's from the protests. They can't have it both ways. It can't be this is an urgent public health crisis. Do as we say or else. And then be like, well, but we really got to have these Marxist protests against police and against law and order on the streets. No. They gave up the right to do this. I actually want to just shout expletives at people now who are saying, come on, guys, we all have to do our part. When I've seen them for weeks, people with platforms, people on TV at some of the other networks out there, silent as the protesters march around, loot, pillage, riot, no social distancing. And not even just at those kind of, there was a big pride parade in Chicago. And, pride parade, great. It's I have no problem with what the parade is representing. My problem is we're not supposed to have parades, right? This is the very basic concept that the Democrats are just gaslighting us constantly on. Oh, well, some parades better than others. Don't know what to tell you. Sorry. A federal mask mandate? Here's the truth of this also. The government can't protect you from this. And they're just taking more control and more of your freedom. We see this bargain play out in so many different ways across society and have and will for all of our lives. The government can't really protect you from this. And in trying to do so, not only are you not going to be protected, but you are going to be losing so many of the core rights that you have. And we already have been. I'm angry at myself. I feel like, how come we haven't been doing civil disobedience in a protest movement against this? In New York, it's impossible because I'm surrounded by commies. But, where is the backlash from the right about the hypocrisy and about the lies here? Where is it? Why aren't we hearing about that? No, just, wear your mask, peasant. Stay home, peasant. Don't ask too many questions, or else Dr. Fauci's going to come for you. You know, has Fauci had any harsh words for the thousands and thousands of protesters? No, of course not. He wants to be liked by the New York Times. I get it. The guy's not a warrior. He's an academic, basically. So he's not into taking the heat. But how many times are they able to be wrong on this before we say enough is enough? What really is the plan? What is the plan when we get past, let's say, when we get to a level of virus that is really, really low? We're going to reopen again. Guess what's going to happen? You're going to have more cases. This is what I've been saying all along. This is what everybody who's watching this has been saying. The open up chorus has not been claiming open up, everything's totally fine, no more. No, it's saying we need to open up and learn to live with this thing. That is the argument. So I don't want to hear anymore, oh, but there's more cases. Yes, correct. And there have been cases all throughout this. Wave up, wave down, wave up, wave down. Depends on where you are. They have not been able to control it. It is out there. It is in community spread. As long as there are pockets of it in the world, never mind just the United States, it's going to come back here. We can't trace this. Think about this. There are in places like New York, they have barriers to reopening based on whether they can trace individual cases. I've been telling you that's insane. Of course it's insane. Oh, and they're going to make sure that the tracers don't ask anybody if they were at the protests. Politics. Not health, politics. That's what they're doing. It's just, I feel like we've already had this debate. And we've already been through the discussion about, oh my gosh, we're going to overwhelm hospitals. We're not overwhelming hospitals. The hospitals, they keep looking at hospital admissions, not hospital stay duration. Find me the cases where there are major hospital systems where I'm not just saying that they, maybe they'd have to move someone from one place to another to where they, but find me a place where you can go into a major metropolitan area of the United States and you say, and you're somebody who has a severe case of COVID-19 and you cannot get the necessary medical attention. We are, 5-6 months into this pandemic now? And that has never happened. But we still hear, we got to flatten the curve. Flatten the curve for hospital capacity was an excuse to flatten the U.S. economy, to lock us in our homes, and to tell us what to do all the time. And also as an outlet for the rage of the anti-Trump left for what were 3 great years under Trump. And, this year so far, it stinks, okay? 2020 has been bad. There's no way around that. Bad year for everybody here, bad year for the world, and yes, the Trump administration. But if we wanted to get better, you know what we have to do? Go on living our lives. All right, they just did this huge buy of remdesivir, which cost over $3,000 a patient use. They're looking at some other treatments for this. Doctors I've talked to have said that they're better now. They understand that they really don't want to put people on ventilators is an absolute last resort for this. I mean, there's been improvement in the understanding and treatment of this, and you already have a large segment of the American population that has beaten this and recovered. And so, we are making our way through this. There is no template for what the Democrats and just the establishment and the media are trying to force us all to do now. To what? Shut down society again, and then the numbers will recede, right? Because if no one's doing it, there'll still be transmissions of this. People will still be getting this. That was happening. At one point when New York still had a pretty high number of new cases, they found out that over 60% of people that were coming in could only have received the virus in the home. So, if you're in a household and one person has to go out and get groceries, guess what? Everybody's at risk from the disease if that person gets it. And that's where a lot of the transmission was happening. So unless you're really going to have a lockdown where no one can leave their house, period, full stop, nobody, for 2 weeks, guess what? It's still going to be out there. And I know we're all getting tired of it. It's the same argument. It's the same nonsense. But we have not made the psychological shift in America that we do the best we can. We use the health resources that we have in our system and we are reopening. That's it. We have not reopened. That is a lie. We are in a lesser state of lockdown. We are not open. We have not returned to normalcy. I just think we need a completely different philosophical approach to this, but we're not going to get there as long as the Democrat Party and the media are incentivized for Americans to be terrified and miserable all the time. We're not going to get there while that's happening. And this is what we have to fight back against.
We must have no stigma, none, about wearing masks when we leave our homes and come near other people. Wearing simple face coverings is not about protecting ourselves. It is about protecting everyone we encounter. In fact, the more we hate the pain and suffering that accompanied the strict stay-home guidelines a few months ago, the happier we should be to take responsible, small steps every day to ensure our country can stay on offense.
For how long, Senator McConnell? How long do we do this? Why not wear goggles, too? Goggles would be helpful. There's a reason why when someone's in a true, full medical protective suit, their eyes are covered as well. So why not we all wear goggles all the time, goggles and masks? And until this virus is officially cured, I guess we have to keep doing that forever. Oh, how much damage are you willing to incur to your society before the vaccine comes out? How much are we all supposed to suffer? The morons in charge have no idea what they are doing. And this is bipartisan now. There are a lot of Republicans. You just heard from Mitch McConnell. There's no stigma to wearing a mask. We want to wear a mask, wear a mask. I don't care. That's great. Look, if I'm sitting in a room indoors with people who are at higher risk, or if it's going to make them more comfortable and they want me to wear a mask, fine. I'll wear a mask. I'm not an anti-mask zealot. But a national mask mandate? So if you live in, Bozeman, Montana, and there's like no cases of coronavirus anywhere, but if the cops see you walk into the general store without a mask on, they're going to fine you. They're going to arrest you. People think that that's sane. That's crazy. It's crazy. But this is what is being held up as somehow intelligent. This is what is being talked about as what the experts want us to do. And then there's, of course, just more of the nonsense that you'll hear from Democrats. Here's the Lieutenant Governor of California, Kounalakis. Play clip 7.
Well, it is extremely important. And honestly, I was very happy to see Mike Pence is finally putting a mask on and signaling. And, I think that that's probably going to be helpful in places like Texas. And yes, probably in the Central Valley, in parts of our state where you do have more people who are listening to the signaling out of Washington, which has been something like, a mask is politicized. If you're in a red state, you reject it. If you're in a blue state, you wear it. This is ridiculous. It's like sunscreen. You wear it to protect yourself. And in this case, of course, you really wear it to protect others and to stop the spread.
You've got major European countries that have reopened schools, reopened businesses, Germany, France, Denmark, Sweden, where effectively very little mask wearing, if any. Less than half the population regularly wears a mask when they're out in public. Okay. Are they just Trumpers? Is that what we're to be told? They're Trumpers? If it were only that easy, oh yeah, wear a mask, it'll stop the spread. Clearly that's not what happened in this country. Okay. I was out for weeks in New York City. You could not find a person anywhere without a mask. Still lots of spread. How? Everyone's locked in their homes. If you weren't in your home, you're wearing a mask. But now we're told, but there were thousands and thousands of cases all over the place every day, new cases. Does anyone ever stop to think this stuff through? The CDC has a study that says influenza mask wearing, for example, does almost nothing. A real peer-reviewed study. So yeah, maybe one person doesn't sneeze in your face. They sneeze in the mask and that stops it. But other than that, just breathing into the air, it's in the air. That's what the study suggests. The World Health Organization, our own health authorities told us 6 months ago, don't wear masks. Now, with no new science to back it up whatsoever, they are saying wear a mask by federal mandate. Again, if you want to wear a mask, God bless, go for it. Do it all the time. Do it in the shower. Do it in bed. Don't ever do anything without a mask on. Go for it. But you're going to tell me that I have to? On pain of what? And based on what evidence? What if I just had a COVID test yesterday? Still have to wear a mask today? Still have to do this all the time? Oh, because it makes other people feel more comfortable? I mean, there are people who live in my building in New York, and I'm being serious, who wear full-on, it looks like hazmat suits. And that's how they go outside every day. I will say this. They look a little bit crazy, but from a science perspective, at least they're taking it. At least they're doing real stuff. Yeah, that will probably protect you. Wearing a little piece of fabric across your mouth, you're pulling it down over your nose. All you have to do is touch something, touch your face. Guess what? Now you got coronavirus. Oh, but if you wear the fabric, it's going to slow the... when the studies come out that show that I'm wrong, I want to see them. But if really we could stop the pandemic just by wearing masks, don't you think we could just stop that? We would have already stopped this? But no one should think for themselves. Listen to the idiots who change their minds every few weeks.